Hey gang, it must be Wednesday. Yes it is, Wisdom Wednesday. Mark Sweeney here from Austin Dental Spa in beautiful Austin, Texas. If you're tuning in for the first time, let me give you a little hint about how things go on Wisdom Wednesdays. We do a kind of scientific section where we talk about things that might help you not only dentally, but live in a healthier, longer life. No difference in that today. We've got two really great topics for you in the scientific section, and then I always end with a health tip. We always have a theme every month, which is why I'm going to miss this hat. I've worn it every Wisdom Wednesday during the month of April because our goal was spring training in April because of Major League Baseball, and we had the subtitle of "We're going to help you knock it out of the park with your health during the month of April." I hope we've done that. If you've been tuning in to all the previous ones, we talked about essential oils last week and how they can help you lead a healthier, longer life. If you missed that, you can go to our YouTube channel and look back on the Facebook archives to last Wednesday and pick that up if you missed it. It was pretty interesting stuff. And so our YouTube channel should be up and running soon, and we will have all of the Wisdom Wednesdays archived. I don't expect anybody to get so turned on by these Wisdom Wednesdays that you watch more than one or two at a time, but we'd be pleased if you did. Also, thank you all for voting in the American Statesman's Best of Austin contest. They changed the name from Best of to Community Awards this year. I don't know who makes these decisions. Anyway, we were in two categories, cosmetic dentistry and best dentist. And I thank you all who told me that you logged in every day and voted. This was kind of the at-large round where anybody could vote for anybody, and they'll take the top five in every category, everything from best breakfast taco to most romantic dining spot in Austin to best rooftop bar to best dentist and best cosmetic dentist. Hope we're in the running again this year. This would be year number 6. We've won one of the two categories, at least one of them every year for 5 years, and twice we won both categories. So thank you all for your support and for logging in and voting. We'll see. The next round will start in a couple of weeks, and it'll be down to only 5 choices in each category, and then they have a big party sometime in the summer and announce who the winners are in each category. So I'll be keeping you informed. Anyway, let's get on to this month. Oh, another thing, April is Oral Cancer Awareness Month. So I've been hitting on that every month since that's a subject near and dear to my heart. We try to do an oral cancer screening on every patient when they're new to the practice, and at least once a year after that, typically when you're getting your teeth cleaned. Main signs of oral cancer are either red or whitish areas in your mouth that didn't used to be there and are persisting and not going away. We need to know about that. You need to let us know about that. If there's anything that just seems to be sticking around and not going away, get somebody to take a look at it. If strange lumps or bumps in the lymph node areas under the chin, all the way out up to the front and down the sternocleidomastoid muscles, something to be concerned about, especially if it's not gone within 2 or 3 days or a week. So watch for those symptoms. Let's keep oral cancer on the decline instead of on the rise. It's actually one of the cancers that has been somewhat on the rise, not because of smokers as much anymore, but because of teenagers and human papilloma virus, HPV, which there is a vaccine out for, but it is transmissible by mouth-to-mouth contact, and a couple other ways too that we won't really go into. But since we're talking about oral cancer, I figured we'll end the month with talking about snuff. Most of you know what snuff is. Some people call it smokeless tobacco. There's actually 2 forms of snuff, and I grew up with a bunch of kids that were out on farms in the country near Houston, Texas, and They were farmers' kids and ranchers' kids, and they had a big round spot on the back of their Wrangler jeans from where they'd carry their snuff patch around, because back then it was frowned on for teenagers to smoke, but dipping snuff was like no big deal. And you could tell because they always carried an empty Coke can around that they spit into, and you wanted to know that that wasn't Coke in that can so that you didn't inadvertently take a drink. There, anecdotally, every high school in Texas back then had at least one girl that picked up her boyfriend's Coke thinking she was getting a Coca-Cola and got his snuff spit juice. So anyway, the kids I grew up with, they did the moist stuff. There's dry and there's moist. And the moist stuff, they'd roll it up in a little ball and put it right down in here. If you want to know what that looks like, watch any Major League Baseball game. Pitchers in Major League Baseball particularly, and a lot of the other players tend to dip snuff, and they put it down in the inside of their lip. Now, there was a common misconception back when I was growing up that snuff was healthier for you than cigarette smoking. Is that true? There's a caveat here. The FDA says yes, it is true only as far as lung cancer is concerned. Cigarette smokers are much more likely to develop lung cancer than snuff dippers. But the difference is the caffeine still goes through the oral lining and into the bloodstream, whereas with smoking, it goes into your lungs and then gets into your bloodstream. What's particular about that? Well, it's an irritant to the inside of the mouth, and I have had many snuff dippers over 44 years of practice in dentistry that got a whitish patch down in the inside of their lip where they were always, most snuff dippers keep it on one side or the other. They have a favorite side. And after 15, 20 years of doing that, that skin starts looking like the skin on the outside of your body, not like the skin should look on the inside of your mouth. It is precancerous. It is not cancerous, but cancer is defined as a group of cells growing in an area that they normally would not. And that certainly is, whether it's benign or malignant is a whole nother topic, but it does, in many people, snuff dipping over a prolonged period of time causes that tissue to change, and sometimes it takes on a life of its own and just starts growing, even if the person stops dipping snuff, because it's already too late. So it has to be excised surgically. Not a fun thing to go through. I've had multiple patients have to go through that because they didn't want to take the chance that it could turn from benign to malignant or travel on through the skin. Here's some other things about snuff dipping. There's a higher risk of cancers of the mouth, like I just talked about, the tongue, gums, and cheek, but mostly the lips, the esophagus, the pancreas. There's a higher risk of heart disease and stroke. There's harm to the developing teenage brain. Teenagers have brains. There's dental problems, which I've certainly seen, discoloration of the teeth, gum disease, especially recession in the areas where the snuff is sitting there for prolonged periods of time. The gum tissue can actually erode away from the teeth and expose more of the root surface that should not be exposed. So some people have even done it for so long that it irritates the gum tissue so bad that their teeth get loose and they end up losing some teeth. And that's a tough area up here in the front to try to replace something that looks natural with people that have lost teeth in the front areas. There's a higher risk of premature birth and stillborn children among pregnant snuff dippers. And because nicotine is addictive, using any tobacco product can, be a habit that's hard to break. I know plenty of smokers that have tried to quit cold turkey and just couldn't do it. So be careful if you're a snuff dipper or snorter. The dry version of it over in Europe, they actually snort it up their nose. We do that with something else here in the United States, but that's a subject for another day. So here's our second topic, sleep apnea. Have you heard of that? Sleep apnea is getting to be a big buzzword or words in dentistry these days. A lot of dentists are jumping on the dental sleep medicine bandwagon. a little too late for me to pick up yet another trick. They say you can't teach an old dog new tricks. I know a little bit about it, probably enough to be dangerous. But sleep apnea, I have patients that are using CPAP machines where they've got a thing over their nose that's strapped to the back of their head that holds it in place, and they're getting positive oxygen fed to them all night long, because without that they would stop breathing for multiple periods. These sleep clinics, they make you sleep there for a couple of nights, and they're monitoring that, and there are people that stop breathing for 45 seconds to a minute at a time, and they do this multiple times throughout the night. And then when they wake up, they're wondering why they don't feel like they've gotten a good night's sleep, because they were practically suffocating themselves. Multiple possibilities for what causes that. They don't know exactly. It's not a genetic thing, we don't think, but there is some kind of genetic component that it can run in families. But typically it's people who are overweight, or who have extra tissue in the back of their throat, or who are genetically born with small throat openings. There are multiple studies like this, but this I found very interesting, and it was a recent article in the Journal of Craniomandibular and Sleep Practice. There actually is such a journal. It was done in November of last year, or was reported last year, using a CBCT like we just put in right before COVID. It's basically a CAT scan for the head and neck area. Does 3D images. In this study, they took 38 adult patients, and they did CBCTs on their head and neck area. Of the 38 people, they were all undergoing orthodontic treatment, and half of them had sleep apnea as a history, health history, and half of them did not. And in this study, the people that had sleep apnea, their bone density was like half the density of the people who did not have sleep apnea. So before, we did not ever know that stopping breathing multiple times throughout the night might affect the bone density levels. Why is this important? Because if you have lower bone density levels, you're more likely at risk to lose teeth because of periodontal bone loss. You're more likely to have jaw fractures if you were to fall and hit your face, or if somebody punched you, especially. And your increased risk of breaking bones anywhere in your body. They only check the head and neck area, but one can assume that it's throughout the whole body that you're losing bone density. It doesn't typically just happen in the head and neck area. So for mild cases, usually doctors will tell you lose some weight, exercise more regularly, drink less alcohol, especially the 2 hours right before you go to bed. Quit smoking if you're a smoker. Use nasal decongestants. Don't sleep on your back. And avoid taking sedative medications such as anti-anxiety things right before you go to bed. Those are for low-level sleep apnea. For intermediate to severe sleep apnea, pretty much you're dealing with a CPAP, which forces oxygen every time you stop breathing. It forces oxygen into your nasopharynx, or that's the CPAP, or a mouthpiece. A lot of dentist friends of mine are making these now and kind of have a little subspecialty in these practice. They're anti-snoring devices, or they're sleep apnea devices. Almost all of them pull your lower jaw forward, which opens your throat up some, so there's that excess tissue can't just flap around back there. And then finally, there's surgery, and I've had multiple patients undergo the surgery where the surgeon actually went in, usually an ear, nose, and throat doctor goes in and takes out that excess tissue and the uvula, the little Tarzan gland that hangs down in the back of your throat. They remove that as well. Is it 100% successful? No. I've had several patients that had that done that did not get any better and ended up on a CPAP machine. I've had more, probably 80%, that actually did get better from the surgery because they were trying to avoid having to wear that oxygen mask all night long. So that's sleep apnea and how it can affect bone density and just general lifestyle. My health tip for the week: turn off those cell phones and computers for the last 2 hours before you go to sleep, because that blue light that's emitted from the screens, especially flat screens that are LED, they can affect your circadian rhythms, which we talked about a month ago in a Wisdom Wednesday. That's your body's natural night-day rhythm. People who work at night and try to sleep during the day can tell you all about it, but it disrupts their body patterns. People that are living in areas that are dark for a good bit of the winter time have trouble with their circadian rhythms. Well, if you're looking at your cell phone and you have it up on bright, like I do in order to see it, or you're working on a computer terminal till right before you go to bed at night, you might be able to get a better night's sleep by cutting that out of your routine for at least 2 hours before you go to bed. And it might, something as simple as that might just help you sleep better. So give it a try. Let me know what you think. I'll see you next week for another version of Wisdom Wednesday. This is our last one in April. So next week, I'll introduce the theme for May, and we're going to have some fun with it. So knock it out of the park, and I'll see you next week.